and services provided by 22 UNRWA health centers across the Gaza Strip to roughly 1.4 million Palestine refugees who live in Gaza. And third, we have Omar Shaban. Omar is the founder and director of the Gaza-based PalThink for Strategic Studies, an independent and non-partisan think tank based in the Gaza Strip. Although today's event is a virtual meeting, we will be taking your questions through Zoom. You have a Q&A feature that you can see at the bottom of your screen. For those calling in by phone or watching our panel on live stream, you can ask questions on Twitter using the hashtag MEI events or email events@mei.edu. If you have any technical issues, please use Zoom's chat function or email events@mei.edu. Feel free to ask a question at any time. We'll be collecting those questions and putting them to our guests at in the third session, in the third round of questions of our discussion today. Lara and I will be going through those questions and, as I said, putting them to each of our panelists. So with that, I'm going to start. We're going to start this morning with Dr. Ghada Al-Jadba. If you could please kind of set the scene for us, specifically on the situation in Gaza, what the situation is, how many cases, what is the level of preparedness, what are the main concerns for you as a healthcare professional in the Gaza Strip, and what are the main challenges that Gaza faces as things progress going forward. Dr. Al-Jadba, please go ahead.
Okay, thank you, Khaled, and hi everyone here from Gaza. Maybe it is an evening in Gaza, so hi to everyone. Good evening, good morning. In fact, the emergency situation has been announced by the president in Gaza on the 5th of March after detecting some cases in Bethlehem City in the West Bank, and with the closure of all of education facilities, including all of UNRWA schools, which provide education to about 280,000 students in Gaza. Up to now, there are 117 detected cases in Palestine. 10 of them, they are in Gaza. The 10 cases detected in Gaza, in fact, they all detected related to quarantine. They are like not indigenous cases. 3 of them, they are persons coming from abroad, and 7 of them, they are staff dealing with the first detected 2 cases. They are mainly policemen. So this means that there is limited contact to those persons. All of the contacts in the quarantine, they were kept in further quarantine for another 3 days after discovery or detection of the cases in the 21st of March. About the preparedness or the emergency preparedness plan, in fact, in the local authority and the Ministry of Health in Gaza, there is continuous plan or emergency preparedness plan with different scenarios according to the situation and according to the stage of COVID-19. They first started with establishment of field hospital at Rafah border. The field hospital now is working, in fact, with the support of the WHO. It contains 40 beds for mild and moderate cases and 6 ICU beds. There are different scenarios and other plans if the cases or more spread of the infection with more detected patients, to have other hospitals to be evacuated to deal only with COVID-19 cases. By the local authority here in Gaza, there is like announcement of restriction and limitation of movement, but it is not complete up to now. They limit also the social gatherings. They close coffee shops, restaurants. Also, they prevent praying, the people from praying at mosques. I think also planning for more restriction of movement is ongoing. For UNRWA emergency preparedness plan, also with different phases, we have started in health program to do separation or what is called the triage, which is recommended by WHO, a triage or separation of patients with respiratory symptoms, which like the suspected cases of COVID-19 will be among them from the other clients who are in the congested and the crowded primary healthcare centers belonging to UNRWA. So we have succeeded to have designated schools because the schools they are not working. So we provide health services from these schools, which are nearby the health center, to treat patients with respiratory cases with symptoms with complete personal protection. So we separated them from the congested health centers, which is mainly to decrease exposure or the spread of the infection, also to decrease the crowd and keep social distance. The social measures mainly which we are doing either in UNRWA or in the local authority, which is mainly we rely on them in order to prevent widespread outbreak in Gaza. Due to the different the situation in Gaza is fragile, is deteriorated, so it will be very difficult to contain widespread outbreak. Also in UNRWA health centers, we have established hotlines in the 22 health centers to activate the telemedicine. So we will continue to provide consultation remotely to 1.4 million Palestinian refugees. If further restriction or escalation of the situation, UNRWA will be responsible to provide the primary healthcare services to all of the population in Gaza as coordinated with Ministry of Health, not only to the refugees. So we will serve refugees and non-refugees with the primary healthcare services, with telemedicine, remote consultations, mobile clinics, and delivery of the medicines to the patients with urgent needs or essential health needs. Also, UNRWA provides food to about 1 million persons or poor persons in Gaza. And due to restriction of movement, UNRWA has started from now to deliver or distribute the foods to the poor people in order to prepare them because of the restriction of movement. And also they are very fragile because a lot of them, their income stopped due to like the restriction of movement and the closure of many of the shops and all of these things. So we will continue to support those poor people by providing the food, so they will ensure providing or continue distributing of the food and providing the health services to the population, to the whole population in Gaza in case of more restriction of movement is imposed. UNRWA has mobilized all of the financial or the limited financial resources, in fact, for COVID-19 response. The main challenges we face here in Gaza, first of all, is the prevailing the dramatic deterioration of the general situation in Gaza. I'm talking about political issues with the blockade, about for 13 days, with deterioration of all of the health determinants, economic, with high level of poverty, social, environmental, the water, quantity, quality of water, electricity issues, and also the highly populated region, like high populated density in Gaza may be one of the most high population density in the world, especially in the refugee camps. We have 8 refugee camps in Gaza, which is very congested, and the infrastructure is very poor. This will be like a good culture for the virus to be like to spread a lot with to have widespread epidemic, which will be really like a disaster in Gaza. The other challenge was the most important challenge is the fragile public health sector in Gaza, collapsing like or the low capacity of the Ministry of Health with staffing, with the medical supplies, with equipment. I can mention one important issue related to COVID-19. We have in Gaza in the public health sector only 60 ventilators. So 60 ventilators to 2 million population. For sure, it is not enough at all, and it will lead to disaster if there is like a widespread outbreak of COVID-19. UNRWA with very limited resources is another, we face another challenge because we should support the local authority here in Gaza, the Minister of Health in Gaza, but in doing like a lot of humanitarian response by the main humanitarian organization which provide public services, but the limited resources really is another challenge. We have raised a flash appeal with 14 million for all of the fields, but still it is another challenge in Gaza. In fact, due to all of these challenges and expecting if there is widespread epidemic in Gaza with all of the constraints and the challenges I have mentioned, this will be uncontrollable or intolerable epidemic in Gaza if Gaza left alone to face that with this blockade and all of the deteriorated situation we have here in Gaza. Thank you.
So this is Lara Friedman. Thank you all for joining us today. Thank you so much, Dr. Jedba. We're going to move now to Omar Shaban. Omar, can you, picking up on where Dr. Jedba left off, can you talk a little bit about how the Gaza authorities are reacting to the crisis, how the population is seeing that reaction and how they are reacting? And I think there's a lot of interest now. There's been a lot of reports about increased Israeli-Palestinian cooperation and coordination. There's a lot of questions about the coordination and cooperation potentially, or the responsibilities of the PA and the authorities in Gaza. So can you address this now more from the political perspective of how this is playing out and what it means on the ground?
Good evening to everybody. The COVID-19 added to the intense relationship. It's a new era between the three authorities that don't talk to each other. And this is what made the situation in Gaza is very unique. Gaza is still controlled by the Israeli. Gaza is ruled by Hamas. Both Israel and Hamas, they don't talk to each other. They don't recognize each other. But coronavirus put a challenge to everybody. The reaction of the Gaza Authority was reluctant in the early days of the corona. They did not take any action. They did not abide with the president decree on announcing emergency state in Gaza. They claim that Gaza is far away, is closed. Coronavirus is very far away. Gradually, they become more serious, and they start to take some measures. The Israeli Authority, the Israeli government realized that any problem in Gaza will impact on them directly. They show some facilitation, some cooperation through directly with some Gaza institution or through the UN. What we hear is the first testing kit that were coming to Gaza. They were donated by the Israeli army. I don't know how many, but then the World Health Organization, they brought to Gaza last week 1,000 kit, or a kit that can enough to 1,000 tests. Up to yesterday, Hamas Authority announced that they carried out 750 tests. So still they have remained another 200 to 150 kits, which is not enough, of course, to do testing for everybody. The Palestinian Authority, in the early days of the corona, they wanted to help to Gaza. They were doing the testing in West Bank because Gaza didn't have the facility until they received the kits. And after they received the kits, they stopped to receive blood sample to be tested in the West Bank. There is a little of cooperation between the PA and Hamas. Hamas claimed that PA has received some $40 million donation from the private sector and from international organization, World Bank, World Health Organization, and some big firms in the West Bank. And the PA did not transfer any part of this money into Gaza. I don't think that PA should transfer some cash. They should transfer some kind assistance into Gaza. Hamas and Israel, they found themselves that they have to cooperate with each other, and Hamas realized that Israel has some sort of responsibility in Gaza as they control the border and they control the entry of the people, and they control the supply of the medical equipment and consumable material into Gaza. I don't want to say that Corona has one positive aspect. Of course, it's very bad in all aspects, but I think as a political analyst, the coronavirus will create a new reality after a while, and the perspective of Israel to Gaza and the perspective of Hamas to Israel, I think, will be slightly different. Both sides will realize that the enmity between the two is not to achieve security between the two. The Gaza Authority, started to be serious after they discover and after the pressure of the society that they have to be serious. We invited to meet with them as some civil society. I met them last week. I met the emergency governmental committee that is dealing with this. There is a committee between the Hamas government and the Hamas movement who are dealing with the situation. And this committee is headed by the head of Hamas, Mr. Sinwar in Gaza. One of the problems is that there is some sort of overlapping between security and civil things. Still, Hamas think the coronavirus is not only a civilian work, it should be tackled by security perspective. They have some plan that they don't share with us. And they know that challenging the coronavirus is another challenge for their reputation and for their ability and for credibility. I think they are doing some good work. I think they want to succeed to prove that they can handle such a crisis. Of course, they lack material, they lack resources, they lack the control over the border, and of course, sometimes they lack some technical and managerial skills. Today, in half an hour, there will be a press conference for the Gaza Administrative Committee that runs Gaza, which is a Hamas-related committee, and I expect some harsh decision like impose curfew in the Gaza Strip. This will be known in the coming 1 hour. Some people, for the people reaction, which I will close, some people in Gaza do think that what is said by the Gaza Authority is not true, is not 100% the full story. There are some other aspects that we don't know or they don't share it with us. Some people still believe that Gaza will not be impacted because there is no international who visit to Gaza. And there is a lot of funny jokes in the social media among Gaza where they confront the virus. When you talk to Gaza about closing the border is closed since 14 years. When they hear that the airport are closed, they make love of that. They said, okay, we haven't been traveling for the past 15 years. So the corona brought the aspect of the siege again in a way that people make fun of them. And I believe that in a week, the coming week is crucial for Gaza, because in a week, the whole 3 weeks of quarantine will be finished. Of course, as Ghada said, there are 25 places as quarantine centers in Gaza, around 6 hotels and 17 schools. The condition in these schools are not really good in terms of separation, in terms of health condition. And of course, sometimes the people themselves don't take it serious. Till now, the Gaza people going out, they go to the beach, they walk. You cannot ask a family with 6 kids to stay at home, and when they have a small home without electricity 6 to 8 hours a day, and there is no jobs and there is no work. So people get out. They think that we will be able to overcome. One of the things that we need to think about it is the unemployment, the poverty, that couple of thousand of unemployed and people become unemployed. In the tourism sector only in Gaza, there are 6,000 new people who become unemployed due to the corona. 6,000 in the tourism, in the small shops, the small restaurant, and in the public and transportation. And if the situation continue for another 2 to 3 weeks, the poverty will be increased, and the pressure on UNRWA and other international organizations will be heavily on this organization to feed the people. So the coronavirus might not be the only direct problem to the people, but the indirect consequences of the corona on the people themselves.
Thanks, Omar. Turning now to Tanya, in Israel, what is Israel's responsibility in all of this? And if you could also address the question of why should Israelis care? Beyond whatever legal or moral questions there are, why should Israelis care what happens in Gaza?
Okay, thank you to MEI and FMEP for organizing, I think, what is a really important conversation, and to my colleagues for their excellent presentations. So I think, when we're talking about the question of Israeli responsibility, I think that one of the most destructive myths out there, and it's a question that we get asked about, of course, all of the time, is that Israel left Gaza in 2005 when it pulled its military installations and settlements from the territory, and that it no longer owes responsibilities there. Now, Gisha, the organization that I proudly run, was founded in 2005, and it was founded precisely to look at what the obligations of our own government would be in light of the disengagement. We had a pretty good sense, and you really didn't need to be a fortune teller to know that it really would maintain control over one of the most important aspects of life, and that's over movement and access. And that's why we chose to focus on movement and access. And I think that right now, the world is getting a better taste for what movement and access really means, and also what it means when it's taken away. And what we've seen as Gisha over the years, really day in and day out, is the extent of movement restrictions that have been placed on the Gaza Strip. Now, this is well before Hamas came to power. Certainly, the restrictions got a lot worse then. But even now, with the world kind of seemingly at a standstill, I think we can all recognize that if there, isn't access for health workers, for aid workers, for food to be circulated, for journalists to get around and be telling us what's going on, really, there's no life possible. So what we've been focusing on, and I don't have time to get into the questions about occupation and international law, but I think that we can all agree that if you have control, there is responsibility that comes with that control. And like I said, the main way that Israel continues to have control over Gaza, and it's not the only way, but the main way, is through movement and access. Like my colleagues mentioned, it has control over the only commercial crossing to Gaza, so all of the entrance of medicine, medical equipment, also the vast majority of movement of people that is possible on normal days is via Israeli territory, all access between Gaza and the West Bank, etc. So I think that, picking up a bit on what Omar ended on, I want to emphasize something that is a main message of Gisha's right now. And that's, that Gaza, of course, needs more protective equipment like everywhere else in the world. It needs more ventilators like everywhere else in the world. Like other places in the world, I mean, the coronavirus is exposing the fragility of the healthcare sector in Gaza. Again, as my colleagues have really mentioned very well. I think what is fundamentally different in Gaza to other places is that the economy has been strangled on purpose for many, many years. And the Strip has suffered for many years from very high unemployment rates, very high youth unemployment rates. And what you're seeing really is that people have absolutely no safety net. And so I want to emphasize that in addition to these vital kind of healthcare needs, that we really also need to be looking at the economic aspects of the impact of the coronavirus in Gaza. And what we're calling on right now is for Israel to remove any restrictions that are related not to security, but rather to this kind of idea of putting pressure on the population or pressure on the Hamas regime. We think a lot can be done to remove obstacles to trade right now. The commercial crossing at Kerem Shalom is still operating, and there are many restrictions that can be lifted to allow that crossing to operate more. In terms of your question regarding Israelis, I think that we can all recognize that this epidemic knows no borders. I think Israeli officials recognize that as well. But again, I think that Israelis need to care about the situation, not just because it could affect them, but because also their government has a responsibility towards residents of Gaza.
So great. So we're going to go to a second round. In the second round, we're actually going to ask all of the panelists to answer a similar question. And Tanya, you sort of got there already, so I think we're going to maybe do the reverse order and start with you. To talk a little bit about what can be done, what needs to be done, and who needs to do that. And Tanya, you've already addressed what you think the Israelis should be doing. I don't know if you want to dig a little deeper into that, if you want to dig a little bit into the international role in terms of international responsibility under humanitarian concerns, international law, whatever. And then we'll go back to Omar and then to Ghada.
Sure, thank you. So I have a lot of points, but I'm gonna probably only mention a fraction of them. Like I said, I think that Israel does need to take meaningful steps to increase trade and increase also production and manufacturing inside of Gaza. So one thing that we're looking at, for example, is any sectors that have to do with food production. That would include things like the fishing sector, that would include agriculture, that would include also the processed food sector. These are sectors that have had various restrictions on them, again, for years. Some of these have been relaxed at certain times, but certainly a lot can be done. So if we look at the fishing sector, you could increase the nautical miles where fishermen are allowed to fish. You can increase the kinds of goods that are allowed in to repair boats, motors, things like that. You can allow fishermen to access the sea safely. With the processed food sector, Gisha has famously been calling for years to free things like cookies, biscuits, chips from Gaza. If these could go to the markets in the West Bank and even in Israel, you could increase production capacity in factories inside of Gaza and increase jobs. Now, again, like I said, the commercial crossing is operating and there is entrance of goods and there is some exit of goods as well, but it's not enough. More can be done. And we think that the COVID response, again, shouldn't just be limited to the health sector. It should look at the economy. Like my colleague said, social determinants of health are very critical, and we need to do everything we can to protect economic activity in Gaza. I think the Israeli authorities should also be more forthcoming about what their plans are should there be an outbreak in Gaza. Right now, we've heard various statements regarding a kind of humanitarian gestures, allowing in equipment or tests that others are paying for. I think the Israeli government can do more, and I think it shouldn't be just about goodwill. It should be a recognition of its responsibilities to the population. I think it should also discuss what would happen if there were an outbreak and whether it would allow patients, COVID patients, in from the Gaza Strip. And I think also that we should be already thinking about the day after. And I hope that this moment shows us that civilians should not be suffering under movement restrictions that are unnecessary. And I think that the day after we should be lifting any remaining restrictions that don't have anything to do with security. Regarding the rest of the world, now there are of course other actors, and again, we don't have time to get into a lot, but I do think of course the PA, the Hamas government are playing roles, and my colleagues have touched on this. I think Egypt can play a role, and certainly also the international community. I do want to mention a few things given I'm assuming that most of the audience is in the United States. I do think it's relevant that we look at what the US can do. The US has, of course, withdrawn funding to the Palestinian Authority and also cut funding to its own aid agency, USAID, which in the past was actually very, very helpful in providing funding, technical skills, and even negotiations vis-a-vis Israel and bringing in vital equipment that was needed in the Strip. So I think that the US should restore funding. And I think funding should also, of course, come from other actors. And I think also other actors should be using their influence vis-a-vis Israel to lift the restrictions that are in place that are unnecessary. And I think this would even have an added effect of making aid more sustainable. money, aid is a symptom of the problem. It's not a solution to the problem. And I think really only with fundamental change in approach and policy can we really see a long-term difference for the better, for everyone in the region, not just for Palestinians, also for Israelis.
Thank you, Tanya. Picking up on that, Omar, what specifically can or should happen at the political level, not just between Hamas and Israel, but between Hamas and the PA? What would make things better? Is it for the PA, for example, to send equipment? Is it for, what sort of measures would you like to see happen at the political level in order for the situation, or to avoid the worst case scenario in Gaza, and also in terms of the international community? So looking at the different levels, intra-Palestinian and sort of international.
Thank you, Khaled. There are many things to be done now by everybody, and I want to be very specific. A couple of days ago, I put in my Facebook that the PA should ask their employees who have been sitting at home for the past 14 years to go back to their work. There are many doctors who are still paid by the PA. They were asked to sit at home in 2007. Some of these doctors have left the country. The problem in Gaza is not only about the equipment, but about the human resources. We lack doctors, a professional. Even those doctors have not been trained to cope with this problem. While we have many doctors, nurses who used to work with the PA before the 2007 when Hamas took over, they were asked by the PA to sit at home. So one of the things that PA should ask, and they spoke, I mean the Prime Minister and the other political faction, they know about this proposal, and there is growing demand for these people to come back. Second, we have a Turkish-built hospital, costed $40 million. Today, there was a news that President Abbas spoke with President Erdogan to operate this hospital. This hospital is fully equipped. It has 200 beds. It has all the machines, the furniture. It didn't work since was completed 5 years ago. Of course, the problem is the operational cost of this hospital. And this hospital should be operated tomorrow. We are in need for that. International community can help in operating this hospital. We need 3 levels of intervention. Of course, Tanya has concluded everything about economy, about everything. First of all, we need from Israel to express clearly that they are responsible about what's going in Gaza, and they will provide whatever assistance is needed, not only small things here and there, but about Gaza, because Gaza is still occupied by the international community and by the Israeli law, and Israel has legitimate responsibility by the law towards Gaza. The Gaza institution need to be empowered by the machines, by the equipment. 1,000 kits is not enough at all. I do believe myself and some of my colleagues think that the discovery of 10 cases in Gaza is very little comparing what could potentially recognize if there is more tests to be done. Only 750 tests were done in Gaza. Around 3,000 tests were done in the West Bank. And they talk about 1,000 tests is done in the West Bank every day. This is why they discover cases every day. But in Gaza till yesterday, only 750 cases. So we need more testing kit, and international community need to support what's going in Gaza. We need to neutralize the situation now. Is not about politics. Politics is put aside. Whether Hamas is recognized authority or not, we need to care about the people. We need to care about those patients if their situation gets worse, and we need to get about the majority of the Palestinian 2 million people living in a very highly densely place, 2 million people. Third, about the economy. And as Tanya said, we need to think about what needs to be done and what needs to be done in the following day of the coronavirus finish. Of course, the siege policy of Israel in Gaza has failed, and they created a problem or an enemy for both sides. While Hamas and Israel were fighting each other in the past 14 years, now they need to fight for one enemy that is challenging everybody. The Palestinian Authority showed a lot of responsibility. The Prime Minister's speech just 3 days ago He mentioned Gaza, and he mentioned that PA is responsible for Gaza. The emergency plan to confront with coronavirus that was developed by the PA mentioned Gaza and cover Gaza, but we need to see a more concrete example of cooperation. It happens that two medical teams came from the West Bank to Gaza 2 weeks ago, stayed 1 week, went around, checked the facility in Gaza, checked the quarantine places, and they were happy about the facilitation and the equipment in Gaza. We need to have more visits from the West Bank into Gaza, West Bank hospital to receive some patient from Gaza if things getting worse. International community need to be supported. The humanitarian organization in working in Palestine, they raised a fundraising campaign of $33 million to deal with the education and with the health, with the food security. And of course, we need to support UNRWA as a major player on Palestinian territory, and mainly in Gaza. And we to support the small NGOs who don't need to provide food, but there is a need for education, for awareness, to support elderly people, to support the handicapped, to reach the marginalized area. So small NGOs need to be supported as well to enable them to deliver services to society. Thank you.
Thank you, Omar. Ghada, can you pick up where Omar left off, answering this more from the perspective of UNRWA, which, as we all know, has an emergency fundraising effort going on and is responsible basically not just for the healthcare, but for education, for food. There's so many aspects. Talking about what can be done, what needs to be done, and in the context of, you know, the entire world really mobilizing for various crises in, you know, there's hotspots around the world, how this can be, if not prioritized, at least given the weight that it needs to get, given the international responsibility and the gravity of the threat in a place like Gaza.
Okay, thank you, Lara. In fact, I want to mention one point, how Gaza was described in terms of COVID-19. They described Gaza, it will be similar to what happened in the Japanese ship. If you heard about the Japanese ship, the people there in the ship affected by COVID-19, they make Gaza like similar to what happened with the prevalence rate or the rate of infection will be maybe 10 times than other countries due to different factors and all of the factors I have mentioned. As Omar also mentioned clearly, UNRWA is the main humanitarian organization or the major one, and even not like other UN agencies. UNRWA provides public services. UNRWA provide public health services, provide education, provide relief and social services, food assistance to the population in Gaza. And in fact, for the last 2 years, UNRWA has been suffering from a financial crisis, which really hit a lot of main and core services provided by UNRWA. So UNRWA now we feel like paralyzed because we cannot do the needed humanitarian support to the local authority. The local authority, they suffer also of shortage in everything, as exactly Omar has mentioned. So we live to be the main player, and we live to be the main providers that the refugees and even now in the emergency, the non-refugee rely on. So more support should be to UNRWA in this crisis. Otherwise, there will be a really uncontrollable disaster with this a fragile situation and deterioration, a dramatic deterioration of all of the aspects of life in Gaza. Without support of UNRWA, in this time we have nearly mobilized all of the financial resources we have in order to procure the protection, the personal protection equipment, which has started to be very expensive. We need to provide this equipment to the health staff who are like the frontline staff. We will continue working with the Palestinian refugees and non-refugees if there is like curfew is imposed, which really is expected to be imposed soon, if not tonight. And also we have other health staff will continue to work in UNRWA. Like we need to maintain the infection control inside the congested camps, the sanitation, which really we have very limited resources in this issue. So UNRWA should be supported. The health system in UNRWA and the health services should be. We need a lot to be a lot of support in like medical supplies. We need to support the hospitalization services. When there is widespread outbreak, the Minister of Health will never be able to work alone. We should support. This virus is killing in terms of absorbing all of the health manpower, because do you know many of them they can be infected. The quarantine issue to the staff. The staff should work for 14 days and kept in quarantine for 15 days, and all of these miss in terms of staffing issue. A lot of the staff, we need the training of the staff. There is a need maybe online or like simply Gaza cannot be left alone because simply it is not a country. UNRWA should be supported more and more. UNRWA again is the main player here in Gaza in terms of food assistance. Maybe after this quarter, UNRWA will not have emergency fund to support the refugees, so they will live without food. With more poverty will increase if the economic situation. It is now it worsen more and more. If there is more restriction of movement, the vulnerable people will be more vulnerable in terms of like economic situation and also health issues. We are trying to support, but what UNRWA have in the last period of time does not make us able to do the enough support. The Minister of Health and the local authority is asking UNRWA to support the quarantine. They need a lot of supplies, either medical, non-medical, food items, non-food items, and up to now, UNRWA doesn't have the capacity to do that. And like watching up to now, maybe the situation hasn't reached to like epidemic, but we are expecting that every day. We need to be prepared, and because of that, we need the support from now to be prepared of any outbreak, which will be non-humanitarian and will be ugly picture. It is not like acceptable at all from the international community. Even the Secretary General mentioned about the support of those vulnerable people like in Gaza. So UNRWA should be supported. In order to support the Minister of Health, medical equipment. When we are talking about 60 ventilators for 2 million, it means nothing. It means nothing, as if we don't have ventilators. So about if we are talking about Japanese ship, we are expecting to have 85,000 of the Palestinians in Gaza will be affected by COVID-19, and 6% of them will be critical. Those critical will like left dying without 60 ventilators means nothing. And I am sure that those ventilators are not in good capacity even. Like we are not talking about 60 good ventilators. So it means nothing. So from now, there should be interference. We rely on social measures. We support the Minister of Health. We try to coordinate with the Minister of Health. But really, believe me, it is like a nightmare for us as public health persons in Gaza. Sometimes we feel paralyzed because of lack of resources. Even the very wealthy countries, they fail to control the virus. But in Gaza, we will just, and even the Minister of Health announced that we are able to control the first episode of the epidemic, but after that we will not be able to do anything. And in this case, a lot of help and needed from now, not when the epidemic started, because if the epidemic started, it is difficult to do anything. We need to prepare from now for this widespread epidemic and to support the main humanitarian organization, which is UNRWA, and the local authority and the Ministry of Health in Gaza.
Thank you, Dr. Ghadba. I wonder if we could all dig a little bit deeper on this question of avoiding that worst case scenario in Gaza. And so now we're going to turn to some of our audience questions. And there's one question in particular that I want to put to each of you. This question is from Joel Bronold. And the question is, for those advocating for the health of those in Gaza, what is the call right now specifically that needs to happen in order to help Gaza during this pandemic? Is it to allow PPE? Is it to bring in X number of ventilators? Is it simply to allow the transfer of patients to other places like Israel or Egypt? Please be as specific as you can, both in terms of the material needs and what needs to happen at the political level. For example, is the call now that Israel must remove the blockade immediately in order to allow all of these things to happen? Or is there some other specific formula that needs to happen? Let's start with Dr. Ghadba and then maybe go around to Tanya and Omar.
So if we are going to be very specific, first of all, ventilators, they are badly needed. This is the first thing. The second thing is medical supplies. The Ministry of Health and even in UNRWA, if we want to support in hospitalization, then we need a lot of hospital supplies in order to run the hospitals, like Turkish hospital. It is well equipped, but medical supplies are needed. The quarantine, we will need a lot of quarantine to deal with the cases, to deal with the contact. So the quarantine, they are not, non-medical items are needed in order to equip the hospitals and or to run out the hospitals. Transfer of patients here, yes, because even if we have the equipment, even if we have the ventilators and the medical supplies, still the health staff, they are not enough, not in terms of number, but also in terms of trained health personnel who will be able to take care of critical cases. So transfer of patients should be allowed for the critical cases. So these are the main items: ventilators, medical supplies, support the quarantine and the hospitals in terms of furnishing these hospitals which is needed, and the medical supplies.
Tanya or Omar, if you would like to tackle the question next, specifically, what does Israel, let me put it to Tanya, what does Israel need to do now in order to avoid a worst case scenario in Gaza?
Thank you. And thank you, Joel, for your question. I mean, I don't think that there's a way to avoid all of the above as an answer. I do think that Israel needs to end the closure for an effective and long-term and sustainable response. I think in the current moment of restrictions on movement for all of us, it's a little bit empty to just use that as a slogan. So I do think we need to break it down and talk about lifting restrictions on access for goods into the strip, access for goods out of the strip in a way that supports both the health response and also the economy. And I think that, like I said, Israel needs to also recognize its obligation. This isn't a question just of humanitarian gestures or goodwill. It's a question of obligations. And I think that by recognizing that, we'll see a more meaningful response. It's not just about handing out a few tests or a few ventilators. It's about what Israel needs to do, and it needs to provide protection to all of the population living under its control, whether that's Israeli citizens or Palestinians in the West Bank or in Gaza.
Omar, are you going to take also something to add to that?
Yes, all of above, providing equipment to Gaza, opening maybe field hospital like the one that undermaking by the American NGO Friendship close to Ares area. unfortunately is not finished yet, but to accelerate the work on that hospital, bringing more material, as I said, and allowing patients from Gaza to go to the West Bank and to Israel if the breakout of the virus. Of course, I understanding the political context, I cannot talk about reconciliation now because the Palestinians themselves, they don't talk about it now. But what I expect from our national authority, the West Bank, the Prime Minister and the Minister to make visit into Gaza. Maybe Israel doesn't have anything to do in this regard. Of course, if the Minister want to come to Gaza, Israel will not be able to say no. So we need to do our homework as a Palestinian. Of course, Israel has a major responsibility toward Gaza, but what we expect from our national authority to come to Gaza, to visit Gaza and to support. One of the things that we asked as civil society is to have one emergency governmental committee, because there is the emergency government in the West Bank and there is a emergency governmental committee in Gaza. It doesn't work. We need to join to make one activity. Of course, the authority in Gaza did not do well when they rejected the presidential decree on the 5th of March to announce a state of emergency in Gaza. We asked Hamas, we told them this is not a good decision. Gaza is part of the Palestinian Authority, Palestinian territory, and you have to be abide by the president decision. I think they realize that now it's not too late to bring the effort together. The international community need to show more support and more financially and in kind into Gaza. There is a need, Khaled and Lara, for education, for awareness. Our doctors are not trained for this. This is a new thing. I know this is new for Jordan and for America, even for the UK, but still we need some training in Gaza for some volunteer and for some health or medicine college in Gaza. There are two medicine college in Gaza, one with the Islamic University, one with Al-Azhar. There are some brilliant doctors or some brilliant medicine student. These doctors can be trained. UNRWA is trying to bring some of those health educators to go with the elderly people, with the poor people. Also, we need to educate some voluntarily, to bring some volunteers from the youth to go around and to make aware, to conduct awareness activity with the society. We need to work to prevent the outbreak of the corona, not to wait until it outbreak, then everybody will be a catastrophe. It will be a nightmare for everybody, for Israel, for Gaza, for the Palestinian territory. It's a nightmare. You cannot imagine how. I think this will be the worst scenario ever. It happened on this earth when 2 million people be in a very isolated, closed place, lack all this kind of resources. I want to answer some of the question about that I have read by the audience about the doctors. If you allow me, just to say that has took over, the Palestinian Authority asked some 50,000 employees who used to work with the PA to sit at home. And these include teacher, doctor, nurses. Some of these doctors and nurses, they continue to sit at home while they were paid by the PA. Some of them have left the country. There was a statistic last year, that around 80 doctors, 80 professional doctors have left Gaza to Europe, to Spain. I know some of these doctors are my friend. They are very good. They have a PhD from Spain, from the UK, from America. They could not continue to work in Gaza for the lack of salaries, lack of equipment, lack of trouble. Some of them, when they come to Gaza, they were stranded. They could not go out to get some training. So they left the country and they are out. We need to bring these people out. We have so many Palestinian doctors around the world. We need to think how to bring them into Palestine, either in the West Bank and Gaza. As you hear in the news, there are some Palestinian doctors in America and in UK and in Italy. They are treating people there. There are many others, Palestinian doctors and professionals, who can't come to Gaza and do some good work here. We need to have a campaign, big campaign, in order to achieve all these things. Thank you.
Thank you, Omar and Lara and Tanya. We're coming to the end of our time here. What is striking to me, listening to all of you, is that on the one hand, you are describing the uniqueness of the Gaza situation and why COVID poses unique challenges. And it's highlighting that these are the same challenges we have everywhere. The problem in Gaza, what makes it unique, is that Gaza is deprived of the normal solutions that are being discussed everywhere else, whether it is, you know, a plane load of doctors and nurses coming in from outside to help, or trying to bring in more resources to protect people, or trying to give people resources to be able to self-isolate, etc. And it is striking how this conflict is really magnifying for the observers what is the ongoing situation in Gaza long before COVID. And potentially you're highlighting how COVID could potentially lead to some changes that post-COVID might lead to a better situation if we allow ourselves to be hopeful. I don't know about optimistic, but hopeful. I think we are going to draw it to a close here. We have a lot of questions in the sidebar, which I hope all of our presenters will look at and maybe consider addressing or writing about, or, you know, if you want to talk to us about trying to get answers out there, we can do that. I want to give a quick plug for the rest of this series. There are 2 more webinars in this series this week. The next one will look at the West Bank and East Jerusalem, and the third one will look at the situation in Israel. They are both going to be, I think, tremendous. I hope you will join us. And lastly, I want to point you, MEI's website has a lot of resources on this. The foundation has resources on our website, and most particularly our presenters' resources are available online as well. So gisha.org, palthink.org, I believe is the website, and of course UNRWA, which is an invaluable resource for information and for people who are looking for ways to help, whether it is through advocacy or donations or to get a sense of what the priorities are. I think those 3 resources are probably where you need to start. And we hope that that will just be the beginning of your engagement on this issue. So for the Foundation for Middle East Peace, I am very happy to have participated. Khaled, I don't know if you have some closing words.
Yeah, just thank you to all our excellent panelists, and thank you, Lara, for co-hosting, and thank you to all our audience members. And just want to reiterate to our panelists that if you are able to take on some of the specific questions that we didn't have time to get to, I think we would all benefit from that, because there are a number of really great questions. But other than that, thank you all, and we hope you'll join us tomorrow for part 2.
Thank you.
Thank you.